Welcome to Medical Intuitively Speaking. I'm Kim Louise, Medical Intuitive and Holistic Nutritionist. Join me on a journey to discuss all things medical intuition, metaphysics, nutrition, and energy healing. I'm so happy you're here. Let's get this started. Well, hello and welcome. In this episode, I wanted to share with you some of the ways that my guides communicate messages regarding the health of my clients by using symbols, metaphors, and sometimes direct messages. I'm also going to share with you a significant gallbladder and bone density health pattern that I see often during my medical intuition sessions. So just for some background information, and if you've already heard this from my previous podcasts, how I go about connecting to the energy of my clients, you can just skip over this section. It'll be about 3 minutes long. So prior to any of my appointments with my clients, I ask that they not tell me anything about their health concerns ahead of time, as that can influence the reading. And I base my readings off of a current headshot photo of them. Once I get their photo and prior to the appointment, I connect to their energy and their body and ask my guides to show me their health concerns. I will use an outline drawing of a body, front and back, on a piece of paper, and in my mind's eye, I will visualize their body within that outline drawing. I will also visualize them standing in front of me. I look at their body from head to toe, front to back, and at each body system during the assessment. My guides will then assist me on the assessment, and I'll receive the information through various ways. I will see it in my mind's eye. I'll hear it, feel it, or sometimes the information will just drop in as a knowing. I'll receive information about current health issues, previous health issues, and even health issues that will reveal themselves in the future. So I'm gonna explain the symbols and the metaphors that they will often show me during the sessions. When they want to show me issues regarding my client's brain health, they will often show me fireworks or a misfiring of energy between the nerve cells. They show me this as a metaphor for brain neurological issues. In one of my previous podcasts, I had explained that with a previous client, I had seen some misfiring of neurons in her brain, and it turned out that she had some growths on her pituitary gland that was causing an issue with her neurotransmitters and her hormones. The fireworks that I see in the brain area can also sometimes represent ADHD. There was another time when my guides showed me a yellow flying canary inside the large intestine of one of my clients. This was their way of letting me know that she was going to have diarrhea. When I explained this to her, she said that she's always had regular bowel movements and that she doesn't see this as an issue. But then unfortunately, the next day I got an email from her letting me know that she did actually end up getting diarrhea the next day. And I want to make it clear, I did not cause the diarrhea. I just received the information regarding the future occurrence of the diarrhea. With another client, when I was scanning her vaginal area, my guides showed me the image of a padlock. Now, this felt very much, unfortunately, like she had been through some sexual trauma. When I explained to her what I saw, she said that she had been sexually molested for years when she was a young girl. My guides wanted to show me that this was negative energy trapped or locked in her vaginal area. This was causing her issues with her sexual, emotional health. Now, though I offered to do an energy healing regarding that trauma, she said that she just wasn't ready yet, and that's understandable. During a different session, while I was closing my eyes to scan a client's body, in my mind's eye, my guides immediately shifted me and my client into a dark room where they then turned on what looked like a black light. I then saw, with that black light shining on her, numerous blotches on her skin. That was an indication that my client previously had skin cancer, which she then confirmed that she actually did have. With another client, during an energy healing session regarding her kidneys, my guides had shown me a sailboat winch. That's a mechanism that's used on sailboats to help to tighten the sail. They showed this to me because of my previous experience with sailboats. This metaphor was used to show me that her kidneys were tight due to a sexual trauma that she had experienced from childhood. This happens to be a completely different client who had also experienced some sexual trauma as a child. Her sexual trauma had impacted her second chakra, that's the sacral chakra. And when that happens, that can impact our kidney health. She had explained that she has indeed had major kidney issues since her childhood. In addition to doing energy healing regarding her sexual trauma, I also guided her through some chakra balancing exercises to not only rebalance that specific sacral chakra, but also she had many other chakras that were not in balance, so I helped to rebalance those with her. During a recent session with a client, while I was scanning her body, when I got to her large intestine, my guides showed me a flashlight shining inside of her large intestine. And they were doing this to show me some growths on her descending colon. That's the large intestine on the left side of the abdomen. She already knew that she had some issues with her colon and had already scheduled an appointment with her doctor for, actually it's upcoming, it's next month, to get a colonoscopy. With another client, while I was scanning her backside, my guides showed me a hollowness, this hollowness from her backside all the way through to her front side. So I was sort of like seeing through her chest cavity from the backside. This was a really symbolic of feelings of a deep sadness for her due to the loss of a loved one. And when I explained this to my client, she said that the deep sadness that I was picking up on was due to the passing of her mother. So the way that my guide showed me was just this empty hollowness, void in her chest. While doing a scan for another client, just using a photograph of her, she was not present, I heard the sound of her swallowing something very heavy. And as it was going down through her esophagus towards the stomach, I then heard like a large clonking sound as it hit her stomach, like she swallowed a big iron weight. What my guides were sharing with me was that she had metaphorically swallowed a dark family secret, and her holding on to that heavy secret was making her sick. When I let her know this, she let me know that there definitely was, unfortunately, a deep, heavy family secret that she was holding on to. With another client, my guides showed me, and I found this fascinating, they showed me a lot of ping pong balls bouncing in the middle of her abdomen. And this was to show me the amount of anxiety that she was feeling and holding on to in her abdomen area. A lot of people hold on to anxiety and stress in the abdomen area. As I mentioned earlier, I'm going to talk about a significant health pattern that I see during medical intuition sessions involving gallbladder health. So I'm going to go ahead and talk about that now. I often see that my clients have issues with their gallbladders or lack of a gallbladder due to the surgical removal of it, both of which lead to other health issues in the body. And unfortunately, people don't know this, especially when they have their gallbladders removed. They're not informed of what that can lead to. If a person still has their gallbladder, oftentimes I'll see that it is colored, during my reading, I'll see that it's colored black or green. This often is an indication that there's an issue with their gallbladder, and those issues will show up as a pain, often right under the right side of the rib, or digestive issues in their intestines, which can show up as gas, bloating, diarrhea, or floating stools that can look greasy or oily. I see more serious issues, though, when a person has had their gallbladder removed. For those that are not already aware, the liver produces bile acid and it shuttles it to the gallbladder, where it is stored until our body needs it. The gallbladder's job is to secrete that bile acid when we eat fats or fat-soluble vitamins like vitamins A, D, E, and K. One of the major functions of bile acid is to emulsify the fat and the fat-soluble vitamins so that they can be digested and absorbed into our lymphatic system and then into our bloodstream and into our cells. If our gallbladder has been removed, or if it isn't functioning properly, whether it be due to gallstones, sludge, or a blockage of some kind, we can end up with a fatty acid deficiency and a deficiency of those really important vitamins A, D, E, and K. And if you're someone who diligently, for instance, who diligently takes your optimal dosing of vitamin D, and yet you struggle with absorption into your blood, and you happen to either not have a gallbladder or have issues with your gallbladder, this could very likely be the reason your vitamin D levels are low in your blood. And one of the major functions of vitamin D, and there are many functions of vitamin D, it's actually a hormone, but one of the major functions of vitamin D is to help with absorption of calcium from your gut into your blood. One of the major functions of vitamin K2 is to help with the transport of that calcium from your blood into your bones and into your teeth. A major pattern that I often see when someone has either had their gallbladder removed or has issues with their gallbladder is that they will also have osteopenia or osteoporosis. If you don't have a gallbladder, it's super important to take bile acids with each meal that has fats or fat-soluble vitamins. This can help with the absorption of those into your lymph, blood, teeth, and bones. If you have a gallbladder but have issues with the proper secretion of those bile acids, it's important to use nutrients that can help to thin the bile and to support the gallbladder and liver health. Some of those nutrients include beet concentrate, taurine, vitamin C, milk thistle, and artichoke extract. So I strongly suggest you look into, if you have any issues with your gallbladder or have had it removed, consider those types of nutrients. Well, I'm going to go ahead and wrap up this episode here. If you are wanting to connect with me, or if you have, if you're interested in a medical intuition session with me, I will post my website information in the show notes. Also, I would love to hear your questions, as I plan to have a future podcast specifically answering your listener questions. You can find my email address in the show notes as well. It's also on my website too. And I would really appreciate it if you would subscribe to this show and leave a nice review, as that can help other listeners to find the show, and it also helps to grow the podcast. So I would greatly appreciate that. And I want to thank you all for listening, and I wish you all the very best in health. Take care.